Hey everyone, Chris Ruhm with the Ruhm-Insurance Agency. You are receiving this video because we discussed the LifeX opportunity, and I want to go over it briefly with you to see if we should proceed further. So the simplest part is I'm going to send you this LifeX Research Corporation assessment questionnaire. As an applicant to become a research associate for employee for LifeX Research Corporation, you must answer all these health questions no, okay? So I'm gonna send this to you. I would stop the video right now. If you can't answer no to all these health questions, you don't need to come back to the video, okay? So let's go to LifeX and what they are. LifeX is a research corporation dedicated to enhancing the global well-being by delivering actionable national health insights and wellness market statistics. I'm a recruiting entity / licensed insurance agent. So I'm looking for people that can answer all those health questions no, and they're willing to become a research associate on a part-time basis. Okay, so you will become an employee of LifeX and have access to their large group health benefits on a part-time basis. So it's a really nice opportunity. You will get paid. So one of the components of the program is you will get an email when you become an employee after we do the application, and you're going to get a W-2 from ADP each time you do a health risk assessment as part of your employment requirements, okay? I'm emphasizing requirements. You do need to do these health risk assessments, all right? It's going to be part of the application. That's how you become an employee of LifeX. Once you become a LifeX employee, you're getting access to their large group health benefits. You're not getting a LifeX insurance plan. You're becoming an employee of LifeX, okay? So that's the first thing. If you go to a provider and you tell them you're an employee of LifeX or you have a LifeX insurance plan, they're going to have no idea who it is. What you do need to do is follow the instructions on the back of the ID card. They offer 16 different plans and they all work a little bit differently, but all the claims are administered through BHPI. And if they're not administered through BHPI, you're going to have problems. So just remember that. On the back of your ID card is BHPI. It specifically tells the provider how to follow the claim process. Now, all the plans have prescription drug coverage. I would say half of the 16 plans only provide benefits for generic medications, and they are all done on a mail order basis. All 16 plans are done mail order. You can get your first 30-day supply if needed at a retail pharmacy, but after the 30 days is up, you have to do mail order, okay? So just take that into consideration. Again, all the generic plans, if you're taking any brand name medications or you're prescribed brand name medications, they have a patient assistance program, but they're not going to be covered on the plan. So that's another component that we'll discuss when we're choosing plans. The major medical plans will cover brand name drugs if you are prescribed one in the future. I usually tell people if you're taking a brand name drug, you probably wouldn't have qualified through these health questions that I showed you earlier. Okay, so it's as simple as you becoming a part-time LifeX Research Corporation employee. You will have access to their large group health plan benefits. We can choose from one of the 16 options. You will get a W-2 from ADP, so it's very important when you get that email that you fill out the necessary information so you can get your W-2 as an employee. There is a annual open enrollment like any other group health plan, and that usually is November 1st or December 5th, and you can make changes to your plans at that time without any health questions. So once you're in this plan, you're good to go as long as the plan's around, and as long as you follow the instructions and have all claims paid through BHPI, you'll be good to go. The plans that you can choose from, the 16 plans, they utilize two networks, the Private Healthcare System Network, PHCS, and the other one is Cigna. So again, we'll determine all that if you are still watching this video and you're still interested, okay? They do offer two dental plans through Humana and Vision, and they're affordable and they're unlimited, which is very rare in the dental insurance arena. So you'll have access to those group benefits as well. So if you're still watching and you're interested in learning more and filling out an application, all applications at this time need to be in by the 22nd of the month for the first of the following month effective date. So if you were to apply on December 22nd or earlier, you can get a January 1st effective date. If you fall between December 23rd and January 22nd, that's your next window that somebody can apply, then you would get a February 1st. There is a 1-month window to apply for each month that you want the effective date to come available. So if you wait till March 23rd through April 22nd, then you'll have a May 1st. So hopefully you get the gist. If we have any other questions, we will address them while we are doing the application. Again, it's just very important that you look over those health questions and make sure you are confident that you're answering the questions no. And then the last step is you are willing to become a research associate and do health risk assessments in the Wellness Hub portal that you will receive upon becoming an employee. Thanks for watching, and we will be in touch. Bye-bye.